Welcome, friends, and thank you for tuning in to another program, the Optimal Health Program here. We're going to talk today about prostate cancer and talk about how important it is to be tested, be evaluated by your doctor. We have a gentleman we're going to interview in just a minute who set up an excellent foundation called the Man Cave Health Foundation for prostate cancer and has been working diligently to try to get people to get their testing done, see their doctor, and to prevent progression of disease. The statistics here, which are staggering, and I can't memorize them all, but if we look at prostate cancer mortality, it's the second leading cause of cancer death in men after lung cancer. In 2022, an estimated 397,430 men died from prostate cancer globally. It seems as well that there are over 3.4 million people living in the U.S. that have prostate cancer, and early detection is critically important. Signs and symptoms don't have to be overwhelming, so a lot of men don't realize they have it when they do, but the key is to capture it and find it early. Let's bring Tom Milana onto the program. Tom, how are you? Thank you for coming on.
You're welcome, Chris. Good to see you again.
So you've done a great deal to educate people, and how did this start? You know, how did you decide that you wanted to create this foundation?
So before we get into that, it's one thing that you said to me that I really want to point out now is you mentioned just now that, symptoms, right? The problem with prostate cancer that I really want to stress is, and why early detection is the key, is because most of the time there are no symptoms. If you have symptoms, it's too late.
Right.
And that's why so many men die of this disease, because when they finally do get symptoms, it's already spread, and that creates a much more problematic, situation than if you got it early. So I just wanted to point that out because you had just said that about 15 seconds ago. So,
Yeah.
if you have symptoms, it's bad. So,
True.
to answer your question, Man Cave Health was started because I got prostate cancer at 48 years old. Unlike most men, I get my blood checked 3 times a year. I don't know why, but once I got out of college, I just started going for my annual physical. Don't know why I was programmed to do that at such an early age, but I always said if there was something wrong with me, I would want to know about it sooner rather than later, right? And the first red alarm went off is my PSA went from a 2 to a 5.5 in a 90-day period, and that's what led me to get it checked out. And lo and behold, 4 months after this PSA increased, I was diagnosed with prostate cancer, and 27 days later, I elected to have surgery. So I was asked to sit on a board after that of another prostate cancer charity, which I didn't end up doing. But I felt there was a need to promote men's health awareness, right? Getting more men to the doctor. For whatever reason, 48% of men do not go for their annual physical. And that's what needs to change, right? And Man Cave Health was started for me and my family to try to improve the overall experience for men when they get to the doctor, and we'll talk about the Man Cave that we built, but B, trying to get more men to go to the doctor. And if men don't want to go to the doctor, we will go out and test them, and that's our new mission now, to go out. We're building mobile vans. We do free testing events all over the country. So that's kind of how Man Cave started and what our focus is currently.
It's interesting that, insurance companies don't necessarily want to pay for blood tests done routinely or more than once, in a blue moon. But, as physicians, we have to teach people, and as, patients and consumers, we have to understand that you need to have the tests done. And as you're saying, if you start to see those numbers rise, even within what's expected to be an okay range, you have to have the doctor evaluate it. So for a very long time, we've been doing the PSA testing in men. And we also have done the free PSA %, which is an important add-on test. If that test is very low, then the risk of prostate cancer becomes very high. We also routinely send men out to get sonograms of the prostate, just to look at the entire thing inside out, size, shape, look to see whether or not when they do the sonogram, that if they drink a lot of fluid to outline the bladder well with the prostate and then urinate, retest it to see if there's any residual urine left over, because that could increase the risk of infection. So we want to do as thorough testing as we possibly can. An interesting story that goes back 25 years, when we first started doing the free percent PSA testing, I had seen a gentleman who was probably in his early 50s, and his PSA, normal regular PSA, was 2.2, which didn't seem to be an issue. But when I turned the page, I was about to tell him his prostate was fine. The free percent PSA was 1, which is obviously very bad. It's supposed to be 30 and above. So just as part of a routine, I sent him to a urologist, have a sonogram done, have the evaluation workup done. They found that he had prostate cancer, and before they wanted to do a procedure, they did a chest x-ray, they found lung cancer. So we had 2 separate cancers in one patient at the same time, which is almost, unheard of. He actually went for the prostate procedure, lung procedure, and it saved his life because that was a cancer, lung cancer, that would have killed him over the course of a few months. So the great thing is doing that extra little test made all the difference in the world. And he lived another 25 years. His daughter would come in with him to the office years ago, and she came in, and I asked how her dad was doing, and he had passed from something different, but he lived another 25 years because of that second little free percent PSA test that we did. So it's always important to get the full testing done.
Yeah, that all starts with going to the doctor, right? And that's what men routinely don't do. So, but I hear your point loud and clear.
Yeah, men sometimes just don't think of going to the doctor. I see female patients all the time. They come in, they get testing, they want to do this. They're more geared towards that because I think psychologically women are taught and understand to think about their body, more so than men. And then men are shocked when they've got some sort of cardiac issue or a prostate issue. So very important to get all the tests done. Even for women, as a second comment, we have them go for ultrasound of the pelvis, and uterus and ovaries, and abdominal ultrasound, even if there are no major issues, because you want to see if something's brewing there, and that's a decent way to see it, early on. Also, we're doing more of the MRIs of the prostate now than ever before, because even little abnormalities, you can pick up with a better test.
Yeah, no doubt.
So the different modalities that were recommended to you varied. I know that the radiation is always recommended, and sort of surgery, removing the entire thing, is recommended. Sometime seed implants in the past were something that were recommended. And what helped help you to make your decision?
Statistics. My doctor told me, based on my Gleason score, treatment is not an option for me. If you remove your prostate, you'll have a 97% chance of never having to deal with this again.
Yeah.
And that made the decision fairly simple for me, right? I haven't looked back. I've had 0 side effects from my surgery. I live a perfectly, normal life. Mm-hmm. It's a good time to be living in this world. The technology with robotic surgery and where we have come in the last 20 years when it comes to this type of surgery, it's night and day, right?
Yeah,
and
of course.
I thank God for robotic surgery, because if I didn't have robotic surgery, the whole conversation would be totally different right now.
Yeah. So before robotic, there were a variety of different side effects or issues that occurred routinely. And I know that you searched, far and wide, and you found who you believe to be is the best prostate doctor in the city. He's at Mount Sinai?
Yes.
Dr.
The
Tawari.
person who operated on me is Dr. Ash Tawari. I did a lot of research prior to my surgery. Fortunately for me, one of my good friends was friends with Michael Milken, who started the Prostate Cancer Foundation. Michael Milken has done more for men's health than probably anyone in the world. So I was fortunate enough to talk to Dr. Jonathan Simons, who actually ran the Prostate Cancer Foundation at the time. And all roads led to Dr. Tawari, based on where I lived, right? I would say, if I lived in California, I wouldn't have flew all the way to New York to have my surgery. There's 4 or 5 guys that are all 1s and 1As. And fortunately for me, Dr. Tawari is an hour away from where I live. And it was a no-brainer choosing him to perform my surgery.
And the procedure is relatively quick. How much time did you think it took?
That's a really good question. I'm going to go assume that it was at least a 4 to 5 hour surgery. I would say around 4 hours. I really don't remember, to be honest with you. All I remember is having to get there at like 3 o'clock in the morning, and I was his first patient of the day, and I was home 24 hours later. So I really couldn't tell you how long it took. All they do is put that mask over you and say, count backwards to 10, and that's kind of like all I remember. So
yeah, he's certainly well renowned. I've referred a lot of people to him based upon your recommendation. So it's not something that men have to be afraid of, but we have to be proactive in getting men used to having that PSA test done. And you want to track it too, because there's some people, as you can describe, where the numbers don't go crazy. They don't go to 10, 15, or 20 for the PSA. They can double, they can triple, and still stay within what you would expect to see as a relatively normal range. Now, traditionally, doctors, when they look at a PSA that's 2 or 3 or 4 or even 5, sometimes doctors are inclined to think, well, maybe it's inflammation from infection. And it's a very common thing. If the free percent PSA is high, then you worry less, but you still, I think, have to do a sonogram, and you still have to pursue it to get a better picture. For a lot of doctors doing the physical exam, the rectal exam with the finger, I don't know how that really compares to the sonogram. Sonogram gives you more information. So as much as doctors rely on the digital rectal exam, I think the sonogram is also a terrific test. And again, if there's any further question, and the doctor should have this level of understanding or his index of suspicion is increased, then the CAT scan or the MRI. And we've had some patients where the PSA looks okay, and the free percent's not bad, but the MRI diagnosed the prostate cancer. So you always have to do that extra test to be extra sure that you know what you're dealing with.
Right, but the key is to know your baseline. You said it yourself. Just because your PSA is a 5 or a 7 doesn't mean you have an issue, right? Knowing what your number is. We always have a campaign, know your number, right? So if your number is a 2 for the last 10 years and it goes to a 7, that's an indicator.
Sure.
But if you've been a 5 or a 6 your whole entire life, and it stays that way, that's not necessarily a bad thing. The bad thing is not knowing what your baseline is, right? And
right.
That's why it's so important to get this test at some point in your life, right? And continue to do it. So
it makes all the sense in the world, and like anything else, people need to get a little bit of an education. They need to know that this test is important, that even small increments of increase over time may be significant. And still, men typically don't want to go to the doctor. They don't want the test done. They're just, they shy away from doing that. So, and even campaigns to tell their wives and girlfriends to tell them they've got to come in to get the testing done also makes a great deal of sense, because in many cases, that's what makes them come in to do the test. Or, as I've seen, I hear from patients that said, I can't believe my friend was diagnosed with prostate cancer and he's young. I said, well, this is something that can happen. Average age of diagnosis, I think, is around 70. But, you don't wait for 70 to do your PSA test or the sonogram. You've got to get these things done and start early. It's aggressive early when the cancers start in a younger age, and that, goes across the board with other types of cancers, including breast cancer for women, prostate for men, colon. However, older men, sooner or later, most men will develop, even you get into your 80s, your 90s, to develop prostate cancer. But you can't look at it that way. You have to look at understanding
say if we live long enough, you're going to get it if you live long enough as a male, right? The key is you need to get it early, and that's part of the problem. Men don't want to get their prostate checked, and that's what needs to change.
I think as well, many of them don't really like the idea of getting the finger rectal exam. And I've spoken to men about this. I said, okay, you don't want to do that? Let's get a sonogram. Get a CAT scan. Let's get something else.
That's not even going to tell the patient. And that's where you said before, education, right? It's, just because even the blood test, the only way to diagnose prostate cancer officially is to get a biopsy. Yeah. And without the biopsy, there's no blood test in the world
Right.
or a sonogram in the world that's going to tell you you have
Yeah,
cancer,
of
right?
course.
So
Sure.
again, it's just an indication. And now with MRIs and the clarity of the pictures, you know, 10 years ago, you had high PSA, they wouldn't even do an MRI. They would just go in and biopsy you.
Right.
Right now, with MRIs, if they don't see anything on the MRI, you avoid getting, the harsher procedure, right?
Hmm.
And going for that biopsy. So technology has definitely led to a lot less biopsies, which is a good thing for men, right?
Sure.
Um, so I think education is the key, right?
Yeah.
It's getting people, they don't teach you in school the importance of going for your annual physical, right? And why it means so much. And I think it starts at an early age. It
Hmm.
doesn't start when you're 50, right? Um,
Yeah.
people need to know, people need to know the importance of early detection, right? No male, I shouldn't say no male, but I'm going to go out on a limb and say 90% of the people that die from prostate cancer every year, it could be avoided, right? But
Yeah.
they didn't find out until it was
It's
too
too late.
late. And I can't stress that enough, right?
Correct.
It's the most curable cancer.
Hmm.
I've been told by many people, all right, when I was first diagnosed, oh, listen, you got cancer, but this is the one you want to get, right? And it's the
Yeah.
truth. As a male, if you're going to pick one cancer you want to get in your lifetime, you want to get prostate cancer. You don't want to get lung cancer,
Of
right?
course. Of
Um,
course.
but again, it's early detection. It's only, like I said, cancer is cancer, and the sooner you find out about it, the better off we're all going to be.
Yeah. I think kind of pushing the idea of getting the blood test done makes a great deal of sense. And sometimes you have to kind of work around a roundabout way to get them to come in to do it. And I speak to wives all the time. Oh, my husband doesn't want to do it. He doesn't want to do this test or that test. I said, just have him come in and do a simple blood test. And you do the blood test, you gather some information. The numbers are good. Okay. If not, then you do the next test. You do something a little bit more, maybe the sonogram or maybe the MRI. And then obviously the urologist has to evaluate and see, what they need to do. If they need to do a biopsy, you got to do it. There's no two ways about it. You got to be proactive. As you say, more men die that don't need to die than, should be able to evaluate early and prevent it from being a problem.
Yeah, and hopefully within the next 5 years, it'll get easier. I think the PSA test is going to be a thing of the past. I think prostate cancer will be able to be diagnosed via urine, right, instead
Hmm.
of blood, right? And
Hmm.
maybe that will make more men go. Um, but again, I can't stress enough. Men need to get tested, and if they don't want to go to the doctor, we go to them. To give you an example, we went to a couple of golf outings last year,
Hmm.
and we brought a mobile van. This guy Robert Smith donated a lot of money, and they transformed the Greyhound bus into a mobile exam room.
Hmm.
And we tested 82 guys at a golf outing last year, and 2 guys had prostate cancer and didn't
Wow.
know they had it,
Wow.
right? It's
Wow.
crazy.
Wow.
So that's kind of, what we're trying to do and do more of. And like I said, men, for whatever reason, and there's a lot of reasons why, I think a lot of men don't go to the doctor because when it comes to the patient experience, when it comes to men, I think the patient experience sucks. I think when women go to the doctor, they have a much better experience. They
Hmm.
got these really nice places to go to. When it comes to men, especially men, like I went through it myself, right? And sitting in a waiting room, packed in like a herd of cattle, and you're waiting, hours to see the doctor.
Yeah.
It's not very conducive to wanting to go to the doctor. I think if the medical field paid more attention to the overall experience and not keeping men waiting
Yeah.
so long, I don't know any
Yeah.
male that's going to take a day off, right,
Yeah.
to go for his annual physical.
Well, a lot of doctors now are doing things to try to get that group of people who don't really want to come to the office. And I've done this for years. And some of the urologists that I know are doing that. They'll do telemedicine. So you can get the patient on the phone.
That's all good, right?
Hmm.
But for your annual physical, it's hard to do it telemedicine, right? You
Hmm.
got to get weighed.
Oh, yeah. Yeah, of course.
You got to do an EKG. So about 5 years ago, on one of my man cave meetings, I was fortunate enough to be introduced to this guy, Stephen Lamb, from the Tisch Men's Health Institute, right?
Hmm.
And he started a men's health center at NYU Langone, and it's literally down the block from where Dr. Tawari's office is. And after being with the same internist for 25 years, I switched to NYU. Why? Because when I went into the office, it was a beautiful space, right? It was decorated nice. You run packed in. You can get coffee. You have internet. You have water.
Hmm.
You scan in your palm, right? And within 5 to 8 minutes, every time I've been there, I get called in, right?
Wow. Yeah.
They
It's
don't
important.
keep you waiting, right?
Yeah.
And that they have weekend hours, they have night hours, so they make it easy
Hmm.
for a male who wants to go to the doctor to
Hmm.
go and not have to kill his whole day doing it,
Yeah. Yeah.
right?
Hmm.
It has been, I don't know if this is true now, but 4 years ago when I started going there, Dr. Lamb said, this has been the most successful outpatient program in the history of NYU Langone.
Hmm.
It's so successful that almost 30% of his patients are women now in the men's
Hmm.
health center.
Wow.
And, I just think that the experience means something when you go to
Of
the
course. Of
doctor,
course.
right?
That's the best comprehensive
Especially
way to
when,
do it.
absolutely, especially when you're, go to, when I go visit Dr. Tawari and I'm sitting in that waiting room, 90% of the guys in there all have cancer.
Hmm.
So give them a little better experience,
Yeah.
right?
Of
It
course. Of course.
doesn't take much or cost much,
Hmm.
to do that. So,
Yeah, with the
um,
telemedicine concept that I was mentioning, for the doctors, the people that don't want to come in, we can get a lab to go to their home to get the blood work done. So at least we can capture the blood work. At least we can capture the PSA. Because if they're not willing to go to the office, at least you can get them started that way and then get them into the office to
absolutely,
review the work.
something is definitely better than nothing. I think
Yeah,
that's great.
yeah. And like I say, and you said awareness is a big issue. The question is always on my mind: why do we have such an increase in these cancers over so much time? And we see it in different populations have much higher risk of cancers, like African American, Hispanic populations. But in the intellectual, pursuit of this, why are cancers occurring much more so over the past bunch of years? Maybe heavy metal exposure, maybe infection. We just don't have answers yet, but we have to keep working
You
diligently.
can figure that out. I was with Dr. Tawari 2 weeks ago for my semi-annual checkup. Every 6 months, I go for a blood test now, and it's the only 2 times a year. I still kind of stress out. They do a PSA test on me twice a year
Hmm.
to make sure it's zero, right? I have no prostate, so
Right.
and thank God, I'm going to be 9 years cancer free in
Wow.
April, but for whatever reason, I was talking to Dr. Tawar, and he's like, Tom, he said, and this is the words he used, quote, there is a prostate cancer tsunami coming,
Wow.
right? And they don't know why,
Hmm.
right? I just spoke to a guy yesterday that was diagnosed at 42 years old, right? Being involved in this
42.
charity, I speak to a lot of people that I don't know. That's kind of why we started this.
Hmm.
When you get diagnosed with cancer, no matter what kind of cancer it is, the first thing you do is you think you're going to die, and then you go to the internet and you search Google,
Yeah.
and there's nothing good that can come,
Right.
on the internet from any type of
It's
cancer.
true.
So a
I
friend
say
of
that all
mine
the
introduced,
time.
yeah, exactly. So I was fortunate enough, like I told you earlier, to talk to Dr. Jonathan Simons 2 days after my diagnosis, and he kind of walked me off a cliff and made me feel, you're going to be fine, and that's what I try to do. I probably talk to 8 to 10 strangers a month,
Hmm.
friends of friends, people that find me through the charity.
Hmm.
Um, but more and more young people are getting prostate cancer and colon cancer. As you know, you're a
Yeah.
doctor.
Yeah.
The insurance company wouldn't pay before your 50th birthday, before your first colonoscopy.
Yeah.
Now for males, they've lowered that to 45.
Hmm.
So why are so many younger males getting colon cancer and prostate cancer? Whoever can figure that out, is on to something.
Yeah. It's hard to
Because
say. And there are
it's
some great
hard.
researchers worldwide. It's just that more research has to be done to try to make sense of it.
Yeah, it's scary when you think about
it's
it.
we've heard and obviously people have heard about Roundup, that weed killer. It's still available in stores, by the way, which is insane. Associated with lymphoma, leukemia, you have to start looking to see whether or not there's a correlation there with prostate cancer, because the chemicals they use to kill plants, the chemicals they use for a wide range of things, might very well correlate with this. So
You think about that. Roundup has paid out billions of dollars to people, right, in
mhm,
lawsuits, and they still continue to sell it.
correct.
So how much are they actually still selling of that, right, to be
Yep.
able to pay off these lawsuits?
Yeah,
It's
billions of
it's
dollars they
amazing
paid.
how it hasn't been banned, right?
Yep.
They continue to sell it and they continue to pay, and
Hmm.
I guess it makes financial sense for them to continue to do that, but people are dying. There's no doubt about that.
There's got to be a big change in the chemical exposure that we've been given over time. And years ago, I was looking at a variety of things, and we're just looking up chemicals that cause cancer. Benzene, which used to be a chemical used to clean mechanical parts in cars and such, causes leukemia. Carbon tetrachloride, another chemical, causes liver cancer. The dyes that they use for plastics, called aniline dyes, they cause bladder cancer. So there are a lot of these things that are out there, and people don't realize you're getting exposure. Heavy metals, lead, mercury, nickel, cadmium, arsenic, aluminum
Well,
are
this
linked with all
morning
these
I was
things.
talking with my wife, who about a lot of these foods, this number 9 food coloring, right?
Hmm.
All these chemicals that they're not allowed to use in certain countries in Europe.
Yep.
They're banned, and they're widely accepted in the U.S. Like,
Yep.
how does that make any sense?
Doesn't make any
Um,
sense. To me, it's the politicians are being paid to not
I
enact laws
agree.
against this stuff. So maybe we've got, with some new guys coming in, specifically RFK Jr., maybe we've got a good way to handle and change all this. There's got
Yeah,
to
well,
be
my
steps
wife read
taken.
something. She read something where they said this one number 9 or whatever it is could be banned by June of this year.
Okay.
I don't know. I'll believe it when I see it, but
Yeah.
we clearly have a different. There's no doubt that our food supply, I think, has a lot to do with this and what we put into our bodies. But it just blows my mind how something is outlawed in a foreign country and it's acceptable to put in food in this
Yeah.
country.
It makes no sense. There was something that I had looked at on the internet talking about children's, cereal and such. And in Europe, they have 3 or 4 different ingredients. Here, it's like 15 or 20 ingredients that they don't allow in Europe. So exactly what you're saying is so. We've got to get all this stuff out of the food. We've got to change what contaminates the water, what contaminates the soil. And companies are still selling Roundup. I see it in a big store that I go to, every time I need something for the house. It's just amazing that it's still there.
Yep, crazy.
But yeah, awareness, education is super important, and that's what you've been doing for a long time. You do a terrific job at it. And, think of it. You found 2 guys at the golf outing that had prostate cancer. You're literally saving someone's life. You save 1 life, that's amazing. 2, it's even more significant. And look at how many more people will go and get these tests as a result of what you're saying and what you're doing. And I think they
Yeah,
respect your history, what you've gone through, and that's why they respect it.
yeah. So one thing I was talking to Dr. Tawari about is when we met is unfortunately we can test all the people we want, but if people don't follow up, it's another problem.
Right.
So we did a testing event in Harlem where I rented out a Baptist church, and no one said that we would test more than 50 men that day.
Hmm.
And I don't like when people put me on the spot and say I can't do things. So what we did is we offered a $25 gift card to every male that got a PSA test.
Wow.
And I tested 302 men.
Wow.
And as you know, so 1 in 8 white males will get diagnosed with prostate cancer in their lifetime.
Hmm.
1 in 4 African Americans will get prostate cancer in their lifetime. Yeah. And being in Harlem, we tested out of the 302 people, they were black, and 44% of the men that we tested that day had elevated PSA.
Wow.
44%.
Wow.
Now again, we can only lead a horse to water, right? We did a great thing And the key is getting them to the doctor.
Yeah.
And what Dr. Tawari suggested we do is raise money to give some of these people actual cell phones, give them burners,
Right.
because the problem is they try to contact them and they can't reach them.
Yeah.
So they're relying on them to call in. They send a letter. Your PSA was, so and so. Please
Right.
come in and set up a meeting. And so we're doing all these great things and testing all these people, but getting them on the phone, believe it or not, is probably harder than getting them to do the test.
Yeah.
So that's something where we're gonna, hopefully try to find a way to do a better job in being able to communicate with these people once once we get them tested, because it's definitely an issue.
Of course, finding the problem and then figuring out how to change and get the result that you need. So whatever it takes to get them to be evaluated and to save those individuals is, super important. But 44%, that's a lot.
So we had women coming in that day for a prostate cancer exam. And my assistant at the time, she's like, ladies, unless you have a prostate, you ain't getting a $25 gift card. So it was kind of hilarious. So,
well, maybe they can bring someone in. They'll bring one person in, bring two people in.
Bring someone in to get their prostate checked, and they can give you the gift card. But it was hilarious. They heard $25, and the women were lined up to get a prostate.
$25, $25. Doesn't buy what it used to, but $25 is still good. Well,
and that's what we raise. And that's what we raise money for, right? So. Yeah. If I can, if I got to pay somebody $25 to get a test and possibly save a life, it's worth it. So.
Sure. How can people reach your foundation? What's the email or the site?
So it's mancavehealth.org, right? It's a public charity. Has a lot about what we've done in the past, and more importantly, what we're going to do in 2025. I have finally hired an executive director to take this charity to places I just don't have time to take it myself. As you know, Chris, I have 10 day jobs, and if all I had to do was focus on Man Cave, we would be a lot further along than we are right now. But as you know, you've met Chris Masters.
Yeah, he's great.
We're doing great things.
Yeah.
This year we just did a testing event in Gainesville at a Florida Gators football game. We tested a couple hundred guys. We did our first NASCAR event in July. We tested a couple hundred guys at Pocono Raceway. We kicked off last year. We did a testing event at the Rose Bowl, Michigan versus Alabama on January 1st. So we're definitely getting more and more nationwide coverage as an organization. We've aligned ourselves, ironically, with Michael Milken's foundation, the Prostate Cancer Foundation. So there's a really good chance. Michael Milken has been doing the home run derby for years with MLB. I think during the month of May, MLB donates like $1,000 for every home run that's hit that month. And now that we have an alignment with Prostate Cancer Foundation, I think we're going to do, he goes to every ballpark every May. That's like his mission. We're going to actually do a testing event. We're going to do 5 testing events at various stadiums throughout the whole entire summer, with PCF. So we're pretty excited about that. And we have big plans for 2025. If you don't know who we are now, you're definitely going to know who we are by the end of next year.
That's wonderful. Yeah, that's where you have to go, where the men go to watch the sports. That's what they are. So, no, it's wonderful. It's a terrific job you're doing. So thank you so much for coming on the program. This is terrific. This will be out up on YouTube immediately, if not sooner, and we'll get this out up through the RSS, according to Frankie.
One point out before we go, if there's anybody that does listen to this that has prostate cancer, we do virtual support groups twice a month, right?
Oh, wow.
It's one of the best things. It's one of the only good things that came out of COVID is we went from in-person support group meetings to doing virtual. And we meet the first and third Wednesday of every month. So if anybody knows somebody that's going through prostate cancer treatment, or, they're going to have treatment, our prostate cancer support groups they've been a godsend. Every Wednesday,
sure.
they continue to grow, and it's just to be able to talk to a group of people that have gone through an experience is definitely beneficial, and I think they're actually better remotely than they are in person, because if you don't want to show your face and keep your camera off during the support group, you can do that and speak up, right? It's purely anonymous if you want it to be. And, it's something that we are very, very proud of, and they continue to get bigger and better all the time.
And people can reach you through the mancavehealth.org
yeah, they can
as well.
Go right on the Man Cave Health website and register for our newsletter. Emails go out all the time on when the next support group is, all about our fundraising events, testing events, etc. Everything can be found on the website, mancavehealth.org.
Great. We're going to grab your logo and put that information up throughout this entire podcast so that when Frank does the post-production here, we'll be able to get that up there so people will be able to look and see and have enough time to, write down the number. Or as I'm told, we can put QR codes on a podcast so people can click on that with their phone.
Absolutely.
So we'll get this all set up as best we can. Always a pleasure to help your company out, and we look to get more and more people tested, look to get more and more people understand what they need to do.
No, thank you again for having me.
Always a pleasure.
Have a Merry Christmas, and I'll see you in the new year.
You got it. Enjoy. Have a wonderful day. Thank you again for coming on.
Bye.
Okay, friends, thank you for listening today. Certainly, we want to give you as much information as we can. The website, if you'd like to take a look at it, is drcalapai.com. And the YouTube, again, Dr. Calapai as well. You can look at these videos. Within the next couple of weeks, we're going to put together a phone number here. We just got set with a phone number where on Saturday afternoons as well, Mondays and Fridays, we're going to set a time to be able to take phone calls from people. So as I've done in the past 30 some odd years, 34 years, with my radio programs on a variety of stations, including WR, WABC, which are live call-in shows. We're going to make this a live call-in show. So for those of you who want to do that, we may start it within the next week or so. Mondays, 12:30, Friday, 12:30, and probably 2 o'clock, 3 o'clock in the afternoon on alternating Saturdays. We'll start to do that. And you can call and ask a question, and we can chat about a wide range of different things. So stay tuned. We have a lot of great information coming for you. Great interviews, patient stories and such. But send us to your friends. Tell everybody about us. We'd love to help you out. Thank you. God bless you all. Have a wonderful Merry Christmas, a Happy New Year, and Happy Hanukkah, of course. Bye-bye now.